10 healthcare needs of pregnant teenagers and their babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems and developmental delays. 7. Early and regular pediatric care is essential for ensuring the health and development of babies born to teenage mothers. 8. Teenage mothers may require education and support in breastfeeding, as breast milk provides essential nutrients and immunity for babies. 9. Family planning and contraception counseling should be provided to teenage mothers to prevent unintended pregnancies in the future. 10. Providing comprehensive healthcare services to pregnant teenagers and their babies is crucial for improving maternal and child health outcomes. Teen pregnancy can have significant physical and emotional health risks for both the mother and the baby. Teenage mothers are at a higher risk of experiencing complications during pregnancy and childbirth, such as premature birth, low birth weight, and preeclampsia. These complications can have long-term health effects for both the mother and the baby, such as developmental delays, chronic health conditions, and even death. Furthermore, teenage mothers may experience emotional and mental health issues during and after pregnancy. It's important to educate young people about safe sex practices and contraception to prevent unintended pregnancies. Providing comprehensive sex education that includes information about contraception and healthy relationships can help young people make informed decisions about their sexual health. It's also important to provide access to affordable and effective contraception options for teens who choose to be sexually active. Teen pregnancy can have significant physical and emotional health risks, but with education and resources, we can help prevent unintended pregnancies and support pregnant teens in maintaining their health. Thanks for watching. Don't forget to like and subscribe for more videos like this.
Title: 27 Foods to Avoid During Pregnancy. Introduction. Welcome back to our channel. Today, we're discussing crucial information for expectant mothers. If you're pregnant or planning to be, it's essential to be mindful of your diet for a healthy pregnancy. Point 1. Raw seafood. Raw seafood, like sushi and oysters, can pose a risk of contamination with harmful bacteria or parasites. Opt for fully cooked options. Point 2. High mercury fish. Avoid high mercury fish, such as shark, swordfish, king mackerel, and tilefish. Mercury can harm the developing nervous system of the fetus. Point 3. Undercooked eggs. Ensure that eggs are fully cooked to avoid the risk of salmonella infection. Point 4. Raw or undercooked meat. Raw or undercooked meat may harbor bacteria or parasites. Cook meat thoroughly to eliminate these risks. Point 5. Unpasteurized dairy. Unpasteurized dairy products can contain harmful bacteria like Listeria. Stick to pasteurized options for safety. Point 6. Excessive caffeine. Limit caffeine intake to avoid potential complications. Opt for decaffeinated beverages when possible. Point 7. High sugar and processed foods. Excess sugar and processed foods contribute to unnecessary weight gain. Focus on whole, nutrient-rich options. Point 8. Unwashed produce. Ensure thorough washing of fruits and vegetables to eliminate any potential contaminants. Point 9. Alcohol. Alcohol can cause developmental issues, so it's best to abstain during pregnancy. Point 10. Artificial sweeteners. Some artificial sweeteners may have uncertain effects during pregnancy. Choose natural sweeteners in moderation. Point 11. Deli meats. Deli meats may carry the risk of listeria contamination. Heat them thoroughly before consumption. Point 12. Soft cheeses. Avoid soft cheeses like feta, brie, and blue cheese, as they may harbor harmful bacteria. Point 13. Excessive vitamin A. High doses of vitamin A found in some supplements and liver can be harmful during pregnancy. Point 14. Raw sprouts. Raw sprouts may carry a risk of contamination, so it's advisable to avoid them. Point 15. Unwashed hands and surfaces. Practicing good hygiene, including washing hands and surfaces, helps prevent foodborne illnesses. Point 16. Excessive salt. High salt intake can contribute to fluid retention. Opt for balanced sodium levels. Point 17. Herbal teas. Some herbal teas may have adverse effects during pregnancy. Consult with your healthcare provider before consumption. Point 18. Excessive intake of vitamins and minerals. Avoid excessive intake of certain vitamins and minerals, as it may lead to complications. Point 19. Excessively hot baths. Hot baths can raise your body temperature, potentially harming the developing fetus. Stick to warm or lukewarm baths. Point 20. Raw cookie dough. Raw cookie dough may contain raw eggs, posing a risk of salmonella. Bake cookies thoroughly. Point 21. Unwashed lettuce. Ensure lettuce and other leafy greens are thoroughly washed to remove potential contaminants. Point 22. Excessive tuna. While fish is beneficial, too much tuna can lead to excessive mercury intake. Choose low mercury options. Point 23. Processed junk food. High in additives and preservatives, processed junk food should be limited for a healthy pregnancy. Point 24. Excessive exercise. While staying active is essential, avoid excessive or high-impact exercise without consulting your healthcare provider. Point 25. Certain medications. Always consult your doctor before taking any medications during pregnancy. Point 26. Smoking. Smoking poses severe risks during pregnancy. Quitting is the best option for the health of you and your baby. Conclusion. Remember, a healthy diet and lifestyle are crucial during pregnancy. Consult with your healthcare provider for personalized advice. If you found this information helpful, don't forget to like, subscribe, and share. Until next time, take care.
Hello, expecting moms. Congratulations on reaching the third trimester of your pregnancy. As your due date approaches, it's important to stay active and maintain a healthy lifestyle. Today, we have compiled a set of safe and effective pregnancy exercises that will help you stay fit, reduce discomfort, and prepare your body for labor. Remember to consult with your healthcare provider before starting any new exercise routine. Let us get started. Point 1. Warm up. Begin with a gentle warm-up to increase blood flow and flexibility. March in place for 2 minutes to warm up your legs and get your heart rate up. Perform shoulder rolls and gentle arm circles to loosen up your upper body. Point 2. Pelvic tilts. Pelvic tilts help relieve lower back pain and strengthen your core. Stand or get on your hands and knees. Gently tilt your pelvis forward and backward, arching and rounding your back. Repeat for 10-15 reps, holding each position for a few seconds. Point 3. Squats. Squats are excellent for preparing your pelvic floor and thighs for labor. Stand with your feet shoulder width apart, toes pointing slightly outward. Slowly squat down as if you're sitting in a chair, keeping your back straight. Exhale as you come up and squeeze your glutes at the top. Aim for 3 sets of 10-12 squats. Point 4. Modified push-ups. Modified push-ups help strengthen your arms, chest, and core without straining your belly. Position yourself on your hands and knees. Lower your chest, tower chest. Point 5. Kegel exercises. Kegels strengthen the pelvic floor muscles, which can ease delivery and postpartum recovery. Sit or lie down comfortably. Squeeze your pelvic muscles as if you're trying to stop the flow of urine. Hold for 5-10 seconds and release. Aim for 3 sets of 10-15 repetitions. Point 6. Side-lying leg lifts. Side-lying leg lifts target the hips and outer thighs. Lie on your side with your head supported by your arm. Lift your top leg slowly, keeping it straight, and then lower it back down. Perform 12-15 reps on each side for 2 sets. Point 7. Cat-cow stretch. The cat-cow stretch helps improve flexibility and reduce back pain. Get on your hands and knees, aligning your wrists under your shoulders and knees under your hips. Arch your back while inhaling, bringing your head up cow position. Round your back while exhaling and tuck your chin towards your chest cat position. Repeat for 10-12 breath cycles. Conclusion. Congratulations, you've completed a safe and effective pregnancy workout for the 3rd trimester. Remember to listen to your body and avoid any exercises that cause discomfort or pain. Staying active during pregnancy can lead to a smoother labor and quicker postpartum recovery. Don't forget to hydrate and get plenty of rest. If you enjoyed this workout, consider subscribing.
The effects of teenage pregnancy, 20 key points. 1. Introduction. Hello everyone, welcome back to our channel. Today, we're diving into a crucial topic, the effects of teenage pregnancy. 2. Higher health risks. Teenage mothers often face higher health risks during pregnancy compared to older women. 3. Educational challenges. Teen moms are more likely to drop out of school, limiting their educational and career opportunities. 4. Economic impact. Teenage pregnancy can contribute to financial strain on families and communities. 5. Emotional stress. Young parents may experience heightened emotional stress due to the challenges of parenthood at an early age. 6. Impact on mental health. Teenage mothers are at a higher risk of experiencing mental health issues such as depression and anxiety. 7. Social stigma. Teen moms often face social stigma and judgment from peers and the community. 8. Parenting skills. Being a parent requires skills that young individuals might not have fully developed, impacting effective parenting. 9. Relationship strain. Teenage pregnancies can strain relationships, leading to higher rates of breakups. 10. Limited social life. Young parents may find it challenging to maintain an active social life due to parenting responsibilities. 11. Child development. Children born to teenage parents may face developmental challenges. 12. Single parenthood. Teenage pregnancies often lead to single parenthood, which can be challenging for both the parent and child. 13. Healthcare access. Access to proper healthcare may be compromised, affecting both maternal and child health. 14. Generational cycle. Teenage pregnancy can perpetuate a cycle, as children of teen moms may be more likely to become teen parents themselves. 15. Limited career opportunities. Teen moms often face difficulties pursuing and maintaining careers, impacting their financial independence. 16. Child poverty. Children of teenage parents are at a higher risk of living in poverty. 17. Higher rates of preterm births. Teenage pregnancies are associated with higher rates of preterm births, affecting the baby's health. 18. Child abuse. Risk. Teen parents may be at a higher risk of unintentional child abuse due to lack of experience and stress. 19. Impact on educational goals. teen moms may struggle to achieve their educational goals, limiting their potential in various fields. 20. Prevention and support. It's crucial to focus on prevention and provide support systems to help reduce the impact of teenage pregnancy on individuals and society. Closing. Thanks for joining us today. If you found this video informative, don't forget to like, share, and subscribe. Let's continue the conversation in the comments below. Until next time, stay informed.
Journey through the stages of pregnancy. Objectives. Define the three main stages of pregnancy: the first trimester, second trimester, and third trimester. Identify and describe the approximate duration of each pregnancy stage, including the weeks and months. Explain the physical and hormonal changes that occur during each pregnancy. What is pregnancy? Pregnancy is a biological process in which a woman's body nurtures and develops a fertilized egg, leading to the growth and development of an embryo and fetus inside the uterus. It occurs when a sperm cell fertilizes an egg, resulting in the formation of a zygote. The stages of pregnancy are typically divided into 3 trimesters, each approximately 3 months long. Throughout pregnancy, the fetus grows and develops, forming organs, tissues, and body systems. The average duration of pregnancy is around 40 weeks, calculated from the first day of the woman's last menstrual period. First trimester pregnancy. Pregnancy weeks 1 to 4. Fertilized egg travels down the fallopian tube and implants into the uterine lining. The fertilized embryo begins to form and consists of a cluster of cells. Development of the neural tube, which will become the brain and spinal cord, begins. Formation of the placenta connecting the embryo to the mother's bloodstream. Pregnancy weeks 5-8. The embryo grows rapidly. Basic features of the baby begin to take shape. The umbilical cord forms, connecting the baby to the placenta. The neural tube closes, marking the completion of the baby's spinal cord. The placenta grows and takes on a crucial role in pregnancy weeks 9-13. Major organ systems have formed, and the baby's structure is more defined. The fetus develops fingers and toes, which are initially webbed but begin to separate. Facial features become more distinct, and the eyes may move closer together. Muscles develop, allowing the fetus to make spontaneous movements. Second trimester pregnancy weeks 14-17. Many of the major organs and body systems functioning or nearing functionality. Fine hair called lanugo begins to cover the baby's body to provide insulation. Bones continue to harden and muscles develop, enabling coordinated movements. The baby starts to practice swallowing and can even suck its thumb. Pregnancy weeks 18-22. The baby experiences a substantial growth spurt with an increase in size and weight. The baby's senses continue to develop, and it can now hear sounds from the outside world. The skeleton continues to develop, and the bone marrow produces red blood cells. A waxy substance starts to form on the baby's skin to protect it in the amniotic fluid. Pregnancy weeks 23-27. The baby's growth continues at a rapid pace, and their body becomes more proportionate. Lungs continue to develop, and respiratory movements, such as practice breathing, occur. Skin becomes less translucent as fat deposits start to develop beneath the skin. Eyelids and eyebrows are fully formed, and the baby's eyes begin to open. Third trimester pregnancy weeks 28-31. Brain development progresses, with the nervous system becoming more complex. The baby's position may shift, with the head typically moving downward into the pelvis. Movements may be more vigorous as they have limited space in the uterus. Organs continue to mature, increasing their readiness for independent functioning. Pregnancy weeks 32 to 35. The baby gains more weight, accumulating fat layers under their skin for energy reserves. The baby's head settles deeper into the pelvis, positioning itself for delivery. Organ systems further mature and develop in preparation for life outside the womb. Movements may feel more restricted due to increasing size and limited space. Pregnancy weeks 36 to 40. The baby's growth slows down, but they continue to gain weight and size. The baby's head becomes engaged in the pelvis, settling into a position for birth. The baby's organs are fully developed and ready for independent functioning. The baby's bones and skull remain flexible to facilitate the birthing process.
Teenage pregnancy is when a female under the age of 20 becomes pregnant. It is a global issue that affects millions of teenagers every year. Teenage pregnancy can have serious physical, emotional, and social consequences for both the mother and the baby. It is more common in low-income communities, where access to contraception and education may be limited. Lack of knowledge about sexual health, contraception, and healthy relationships can contribute to teenage pregnancy. Teenage mothers are more likely to drop out of school, which can limit their future opportunities and earning potential. Teenage fathers may also face financial and social challenges as a result of the pregnancy. The rate of teenage pregnancy has been declining in many countries, but it remains a significant problem in some regions. Prevention programs that provide education, counseling, and access to contraception have been effective in reducing the rate of teenage pregnancy. Support for teenage parents, including medical care, childcare, and education, can help mitigate the negative effects of teenage pregnancy.
Title: Effective PCOS Treatment, 20 Key Steps to Manage Polycystic Ovary Syndrome. 1. Introduction. Greet your viewers and provide a brief overview of PCOS. Mention the importance of early diagnosis and management. 2. Understanding PCOS. Explain what PCOS is and its impact on women's health. Highlight common symptoms such as irregular periods, acne, and weight gain. 3. Seek professional help. Emphasize the importance of consulting a healthcare professional for a proper diagnosis. Encourage viewers to find a healthcare provider experienced in managing PCOS. 4. Lifestyle modifications. Discuss the role of diet and exercise in managing PCOS symptoms. Suggest a balanced diet with emphasis on whole foods and regular physical activity. 5. Weight management. Address the link between PCOS and weight gain. Provide tips on healthy weight loss strategies, if applicable. 6. Medication options. Briefly explain common medications prescribed for PCOS, such as birth control pills and anti-androgens. Highlight the importance of medication adherence. 7. Nutritional supplements. Discuss supplements like inositol and vitamin D that may benefit women with PCOS. Emphasize consulting a healthcare professional before starting any supplement regimen. 8. Fertility considerations. Touch on the challenges PCOS may pose to fertility. Mention fertility treatments and options for those planning to conceive. 9. Hormonal balance. Explain how hormonal imbalances play a role in PCOS. Discuss hormone therapy options prescribed by healthcare professionals. 10. Regular monitoring. Stress the need for regular checkups and monitoring of PCOS symptoms. Encourage open communication with healthcare providers. 11. Stress management. Discuss the impact of stress on PCOS symptoms. Suggest stress reduction techniques such as meditation and yoga. 12. Sleep hygiene. Highlight the importance of adequate sleep for overall health. Discuss the link between PCOS and sleep disturbances. 13. Skincare. Address skin-related concerns associated with PCOS. Provide skincare tips to manage acne and other skin issues. 14. Customized treatment plans. Acknowledge that PCOS treatment is not one-size-fits-all. Encourage viewers to work with their healthcare providers to develop personalized plans. 15. Educational resources. Recommend reliable sources for further PCOS education. Mention reputable websites and support groups. 16. Community support. Emphasize the value of connecting with others who have PCOS. Mention online forums or local support groups. 17. Ongoing education. Encourage viewers to stay informed about new developments in PCOS research. Highlight the importance of staying proactive in managing one's health. 18. Mind-body connection. Discuss the impact of mental health on PCOS. Encourage practices that promote a healthy mind-body connection. 19. Long-term outlook. Discuss the long-term management of PCOS. Address the potential impact on overall health as women age. 20. Conclusion. Summarize key points. Encourage viewers to take a proactive approach to their PCOS management. Remember to tailor the script to your audience and provide accurate, up-to-date information. Fast track to fertility, expert tips from a leading doctor. 1. Introduction. Welcome viewers. Today we're sharing the top 20 tips to boost fertility and increase your chances of getting pregnant fast. 2. Healthy lifestyle. Maintain a healthy lifestyle with a balanced diet and regular exercise to support overall well-being. 3. Nutrient-rich foods. Focus on nutrient-rich foods, including fruits, vegetables, whole grains, and lean proteins to enhance fertility. 4. Hydration. Stay well hydrated by drinking plenty of water, promoting optimal reproductive health. 5. Limit caffeine and alcohol. Reduce caffeine and alcohol intake, as excessive consumption can impact fertility. 6. Maintain a healthy weight. Achieve and maintain a healthy weight, as both underweight and overweight conditions can affect fertility. 7. Regular exercise. Engage in regular moderate exercise, which can positively influence reproductive health. 8. Balanced hormones. Ensure hormonal balance through a healthy lifestyle and, if needed, consult with a doctor for guidance. 9. Quit smoking. Quit smoking as it has detrimental effects on fertility and reproductive organs. 10. Stress management. Practice stress management techniques such as meditation, yoga, or deep breathing to reduce stress levels. 11. Regular checkups. Schedule regular checkups with a fertility specialist to monitor reproductive health. 12. Know your cycle. Understand your menstrual cycle to identify your most fertile days and optimize conception timing. 13. Tracking ovulation. Use ovulation prediction kits or apps to track ovulation accurately for better timing. 14. Position matters. Experiment with different sexual positions to increase the chances of sperm reaching the egg. 15. Optimal timing. Be consistent with intercourse during the fertile window to maximize the chance of conception. 16. Sperm health. Encourage sperm health by avoiding hot tubs, tight underwear, and excessive heat exposure. 17. Preconception supplements. Consider taking preconception supplements like folic acid to support a healthy pregnancy. 18. Limit exposure to harmful substances. Minimize exposure to environmental toxins and chemicals that may affect fertility. 19. Fertility-friendly lubricants. Use fertility-friendly lubricants that do not hinder sperm movement. 20. Patience and emotional support. Be patient and seek emotional support during the fertility journey, understanding that it may take time. Conclusion. Thank you for watching. Implementing these tips can significantly boost your chances of getting pregnant fast. Remember, consulting with a fertility specialist is crucial for personalized advice.
Boy symptoms during pregnancy. Most common sign of baby boy. 1. Pregnancy, a natural process of childbirth, often leads to speculation among family and friends regarding the baby's gender. 2. In this video, we'll explore common symptoms associated with carrying a baby boy during pregnancy. 3. New viewers are encouraged to subscribe to the channel for more informative content on pregnancy. 4. Hormonal changes during pregnancy can occur regardless of the baby's gender, affecting various aspects of a woman's body. 5. Increased acne during pregnancy is often associated with the likelihood of carrying a baby boy. 6. Cravings for salty and sour foods are believed to indicate a higher chance of carrying a baby boy. 7. Pregnant women can indulge in cravings while prioritizing healthy and safe food choices. 8. A low abdomen pregnancy belly is considered a symptom of carrying a baby boy. 9. Women carrying boys may have a pregnant belly positioned closer to their pelvis. 10. Changes in urine color may serve as an indicator of the baby's gender, with darker urine suggesting a higher likelihood of a baby boy. 11. Breast size changes during pregnancy, with a common perception that the right breast is larger than the left when carrying a boy. 12. Cold hands and feet in pregnant women are often interpreted as a sign of carrying a baby boy. 13. Dry hands, despite applying lotion, may indicate the presence of a baby boy in the womb. 14. Hormonal changes during pregnancy can affect hair growth, with accelerated growth potentially signaling the presence of a baby boy. 15. Weight gain is a typical occurrence during pregnancy, but a significant pregnant belly with minimal weight gain elsewhere may suggest carrying a baby boy. Title: Managing Pregnancy Weight Gain 20 Tips for a Healthy Journey. 1. Introduction. Welcome viewers and address the importance of managing weight during pregnancy. 2. Consult your healthcare provider. Emphasize the significance of consulting with a healthcare professional before making any changes. 3. Understand healthy weight gain range. Explain the recommended weight gain range based on pre-pregnancy BMI. 4. Balanced nutrition. Stress the importance of a well-balanced diet, including fruits, vegetables, whole grains, and lean proteins. 5. Stay hydrated. Remind viewers to stay hydrated by drinking plenty of water throughout the day. 6. Regular exercise. Highlight safe exercises during pregnancy, such as walking, swimming, and prenatal yoga. 7. Monitor portion sizes. Discuss the significance of portion control to avoid overeating. 8. Choose nutrient-dense foods. Encourage the consumption of nutrient-dense foods for both the baby's and mother's health. 9. Limit added sugars and processed foods. Advise viewers to minimize the intake of added sugars and processed foods for a healthier pregnancy. 10. Include healthy snacks. Suggest healthy snack options to curb cravings without compromising nutrition. 11. Listen to your body. Encourage women to pay attention to hunger and fullness cues. 12. Weight monitoring. Discuss the importance of regular weight monitoring under the guidance of healthcare professionals. 13. Manage stress. Address the impact of stress on weight and provide tips for stress management during pregnancy. 14. Adequate sleep. Emphasize the importance of sufficient sleep for overall well-being. 15. Support system. Highlight the role of a supportive network during pregnancy. 16. Educate on gestational diabetes. Discuss the link between gestational diabetes and weight and ways to manage it. 17. Limit caffeine intake. Remind viewers to moderate their caffeine intake during pregnancy. 18. Healthy cooking methods. Encourage the use of healthy cooking methods like grilling, steaming, or baking. 19. Postpartum planning. Discuss the importance of postpartum planning for a smooth transition and healthy lifestyle continuation. 20. Celebrate non-scale victories. Encourage celebrating accomplishments beyond the scale, focusing on overall health and well-being. Conclusion. Summarize the key points and express encouragement for a healthy pregnancy journey. Remember to tailor the script to your audience and consult with healthcare professionals for personalized advice.
Welcome to Healthcare Lover. Today, we're going to discuss the top 10 foods to eat and avoid during pregnancy to ensure a healthy journey for both you and your baby. Point 1. Folate-rich foods. First on our list is folate-rich foods. These include leafy greens, lentils, and citrus fruits. Folate is essential for neural tube development in the baby. Point 2. Lean protein. Lean protein sources like chicken, fish, and tofu are crucial for baby's growth and maternal health. Avoid undercooked or raw seafood. Point 3. Calcium-rich dairy. Next up, calcium-rich dairy products such as milk, yogurt, and cheese support the baby's bone development. Opt for pasteurized options. Point 4. Iron-packed foods. Iron is vital during pregnancy. Include foods like lean red meat, beans, and fortified cereals to prevent anemia. Point 5. Fiber-packed fruits and vegetables. Fiber is your friend during pregnancy. Fruits, veggies, and whole grains help with digestion and reduce constipation. Point 6. Healthy fats. Healthy fats from avocados, nuts, and olive oil are essential for baby's brain development. They also help with your skin and hair. Point 7. Hydration. Staying hydrated is crucial. Drink plenty of water and consider herbal teas, but limit caffeine intake. Point 8. Foods to avoid, raw seafood and unpasteurized products. Now, let us discuss foods to avoid. First, steer clear of raw seafood and unpasteurized dairy products to prevent foodborne illnesses. Point 9. High mercury fish. High mercury fish like shark and swordfish should be avoided as they can harm the baby's nervous system. Point 10. Processed and high sugar foods. Lastly, minimize processed and high sugar foods. They can lead to excessive weight gain and gestational diabetes. Conclusion: to sum it up, a balanced diet during pregnancy is crucial for a healthy mom and baby. Remember to consult your healthcare provider for personalized advice. Call TO Action. If you found this information helpful, don't forget to like, share, and subscribe to our channel for more pregnancy tips and advice. OUTRO, thanks for watching, and we wish you a safe and healthy pregnancy journey. Welcome back to our channel. Today, we're diving into the topic of normal delivery and discussing whether it's the right choice for expecting mothers. Giving birth is a transformative experience, and there are various methods available. Let us explore the pros and cons of opting for a normal delivery. Point 1. Natural process. Host. Normal delivery, also known as vaginal birth, is a natural process that has been practiced for centuries. Many argue that it is the way our bodies are designed to bring new life into the world. Pro. Natural process. Normal delivery allows the mother to experience the natural progression of labor, which can enhance the bond between mother and child. It also allows the mother's body to release hormones, such as oxytocin, which aid in breastfeeding and postpartum. Recovery. Con. Pain and discomfort. While normal delivery is a natural process, it can involve intense pain and discomfort during labor. This can be challenging for some women, and pain management techniques like breathing exercises and epidurals may be necessary. Point 2. Faster recovery. Host. Another aspect to consider is the recovery period after childbirth. Let us take a closer look at the pros and cons related to recovery. Pro. Faster recovery. Compared to a cesarean section, normal delivery typically results in a shorter hospital stay and faster postpartum recovery. Women who have a normal delivery may find it easier to resume their daily activities and care for their newborn. Con. Physical trauma. Despite the faster recovery, normal delivery can cause physical trauma, such as perineal tears. Recovery from these tears can take time and require additional care and attention. Point 3. Lower risk of complications. Host. Ensuring the safety of both the mother and baby during childbirth is a top priority. Let us discuss the pros and cons associated with the risk of complications. Pro. Lower risk of complications. In many cases, normal delivery is considered a safer option compared to cesarean sections. It carries a lower risk of infection, blood loss, and complications related to anesthesia. It also promotes natural immune system development for the newborn. Con. Unpredictability. Normal delivery is not without risks. Complications such as umbilical cord prolapse or shoulder dystocia can occur during labor. These situations require immediate medical intervention to ensure the well-being of both mother and baby. Point 4. Support and guidance. Host. Having a strong support system and access to guidance is crucial during childbirth. Let us explore the pros and cons related to support and guidance during normal delivery. Pro. Emotional support. Many women find comfort and reassurance in having their loved ones present during labor. The support of a partner, family members, or a doula can help alleviate anxiety and provide encouragement. Con. Limited control. While having a support system is beneficial, the process of normal delivery can sometimes be unpredictable. This lack of control can be challenging for some women, leading to increased stress and anxiety. Conclusion. Host. In conclusion, the decision to opt for a normal delivery or any other birthing method is a personal one that should be made after careful consideration. Let us summarize the pros and cons we've discussed. Normal delivery is a natural process that promotes the release of beneficial hormones and strengthens the mother-child bond. Faster recovery and shorter hospital stay are advantages of normal delivery, but physical trauma such as perineal tears may occur. Emotional support during labor can be comforting, but the lack of control in the process can cause stress and anxiety. Remember, every pregnancy is unique, and it's essential to consult with healthcare professionals to make an informed decision. We hope this video has provided you with valuable insights to help you make the best choice for yourself and your baby. Don't forget to like and subscribe.
Step-by-step guide to in vitro fertilization, IVF. How IVF works. 1. Introduction. Welcome to our step-by-step guide to in vitro fertilization, or IVF, the groundbreaking process that's helped countless families realize their dreams of parenthood. 2. Step 1. Fertility medications. The journey begins with fertility medications, typically administered as shots. These medications stimulate your ovaries to produce multiple mature eggs. The goal: to harvest 10-15 eggs, a process that typically takes about 2 weeks until your eggs are ready for retrieval. 3. Step 2. Egg retrieval. Next up is the egg retrieval process, a brief procedure lasting 15 to 30 minutes. During retrieval, a doctor utilizes ultrasound guidance to insert a thin, hollow tube through your vagina and into the ovary containing the eggs. A suction device connected to a needle gently retrieves the eggs from each follicle. 4. Step 3. Fertilization. Now, it's time for fertilization, a critical stage in the IVF process. In traditional IVF, eggs and sperm are left in a laboratory dish to fertilize naturally. Alternatively, in intracytoplasmic sperm injection, ICSI, a single sperm is directly injected into the egg for fertilization. This method bypasses natural barriers, increasing the likelihood of successful fertilization. 5. Step 4. Embryo development. Once fertilization occurs, the embryo begins to divide its cells, eventually reaching the blastocyst stage, 5-6 days post-fertilization. At this stage, multiple embryos are carefully selected for transfer back into your uterus. 6. Step 5. Embryo transfer. The final step, embryo transfer. Multiple embryos are transferred back into your uterus with the hope that at least one will successfully implant and begin to develop. 7. Conclusion. And there you have it, a comprehensive overview of the IVF process, from fertility medications to embryo transfer. If you're considering IVF or simply curious about the procedure, don't hesitate to reach out to a qualified fertility specialist. Thanks for joining us, and we wish you all the best on your journey to parenthood.
Introduction. Greet your audience and share your excitement about discussing pregnancy must-haves. Mention that these are items you found essential during your own pregnancy. Comfort is key. Maternity pillow. Discuss the importance of a good maternity pillow for comfortable sleep. Mention different types available and why you recommend a specific one. Stretch mark cream. Talk about the changes in skin during pregnancy. Recommend a stretch mark cream or oil that worked well for you. Maternity wardrobe. Maternity clothes. Emphasize the need for comfortable and stylish maternity clothes. Highlight key pieces like maternity leggings, nursing bras, and loose-fitting tops. Belly band. Explain how a belly band provides support for the growing belly. Share your experience with using one and recommend brands. Health and wellness. Prenatal vitamins. Stress the importance of prenatal vitamins for both mom and baby. Mention any specific brands or types that your healthcare provider recommended. Hydration. Remind viewers to stay hydrated during pregnancy. Suggest a favorite water bottle or hydration method. Preparing for baby. Hospital bag essentials. Discuss what to pack in your hospital bag. Include items like comfortable clothing, toiletries, and essential documents. Baby registry must-haves. Touch on key items to include in your baby registry. Mention practical items like a crib, stroller, and car seat. Self-care, pampering products. Recommend self-care items for relaxation. Recommend self-care items for relaxation. This could include a favorite scented candle, bath salts, or a good book. Prenatal yoga or exercise. Share the benefits of staying active during pregnancy. Recommend prenatal yoga or exercises that worked for you. Support system. Joining a mom group. Discuss the importance of a support system. Suggest joining a local or online mom group for advice and camaraderie. Partner involvement. Highlight ways partners can be involved and supportive during pregnancy. This could include attending prenatal classes together or helping with household chores. Closing. Summarize the key pregnancy must-haves discussed. Encourage viewers to share their own must-haves in the comments. Remember to speak from your own experiences, and make it personal to connect with your audience. Good luck with your YouTube video. Introduction, greetings and welcome. Mention the importance of a healthy diet during pregnancy. Point 1, balanced diet. Emphasize the need for a well-balanced diet. Include a variety of food groups, fruits, vegetables, whole grains, proteins, and dairy. Highlight the importance of getting essential nutrients from different sources. Point 2, folic acid and iron. Discuss the significance of folic acid in preventing birth defects. Mention good sources of folic acid, leafy greens, citrus fruits. Fortified cereals. Highlight the importance of iron for preventing anemia during pregnancy. Include iron-rich foods, lean meats, beans, spinach, and fortified cereals. Point 3, omega-3 fatty acids. Explain the benefits of omega-3 fatty acids for the baby's brain development. Include sources of omega-3s. Fatty fish like salmon, chia seeds, flax seeds, walnuts. Point 4, adequate hydration. Stress the importance of staying hydrated during pregnancy. Recommend water as the primary beverage. Limit caffeine intake and avoid sugary drinks. Point 5, calcium for bone health. Discuss the need for calcium in supporting the baby's bone development. Include good sources of calcium, dairy products, fortified plant-based milk, leafy greens. Point 6, small, frequent meals. Suggest eating smaller, more frequent meals to ease digestion. Emphasize the importance of snacks with a balance of nutrients. Point 7, foods to avoid. List foods that should be avoided during pregnancy: raw fish, unpasteurized dairy, excessive caffeine, etc. Explain the reasons behind these restrictions for the baby's safety. Conclusion, recap the key points. Encourage consulting with a healthcare provider for personalized advice. Invite viewers. Welcome back to our channel. Today, we're diving into a topic that many of you have requested, the early signs of pregnancy. Whether you're trying to conceive or just curious, these symptoms could be indicators of an exciting journey ahead. Point 1, missed period. One of the most common early signs is a missed period. The absence of your regular menstrual cycle could signal pregnancy. Point 2, breast changes. Pay attention to changes in your breasts. Increased sensitivity, tenderness, and darkening of the areolas might occur. Point 3, fatigue. Feeling unusually tired or exhausted. Pregnancy hormones can cause fatigue. Point 4, nausea and morning sickness. Many pregnant women experience nausea, often referred to as morning sickness. It can occur at any time of day and might be triggered by certain smells or foods. Point 5, frequent urination. Have you noticed yourself visiting the bathroom more often? Pregnancy can lead to increased urination due to hormonal changes. Point 6, food aversions and cravings. Your taste preferences might suddenly change. Cravings for specific foods or aversions to others could be a sign. Point 7, mood swings. Hormonal fluctuations during early pregnancy can impact your mood. Don't be surprised if you find yourself feeling emotional or irritable. Point 8. Abdominal bloating. Some women experience bloating or a feeling of fullness in the abdomen. It could be attributed to changes in hormones and digestion. Point 9. Increased basal body temperature. If you've been tracking your temperature, you might notice a sustained rise. This can indicate pregnancy, but it's important to track consistently. Point 10. Implantation. Bleeding. Spotting or light bleeding might occur when the fertilized egg attaches to the uterine lining. It's often mistaken for a light period. Conclusion. Keep in mind that these symptoms can vary widely among individuals. If you suspect you might be pregnant, it's always a good idea to take a home pregnancy test or consult with a healthcare professional for accurate guidance. Outro. Thanks for joining us today. If you found this video helpful, don't forget to hit that like button and subscribe for more informative content. Remember, every pregnancy journey is unique, so stay informed and take care of yourself. Until next time.
healthcare needs of pregnant teenagers and their babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems and developmental delays. 7. Early and regular pediatric care is essential for ensuring the health and development of babies born to teenage mothers. 8. Teenage mothers may require education and support in breastfeeding, as breast milk provides essential nutrients and immunity for babies. 9. Family planning and contraception counseling should be provided to teenage mothers to prevent unintended pregnancies in the future. 10. Providing comprehensive healthcare services to pregnant teenagers and their babies is crucial for improving maternal and child health outcomes.
Title: How to Check a Pregnancy Test, a Comprehensive Guide. 1. Introduction. Welcome to our guide on how to check a pregnancy test accurately. 2. Importance of timing. Timing is crucial for accurate results. Discuss when to take the test for the best outcome. 3. Understanding pregnancy tests. Explain the types of pregnancy tests available, urine tests, and blood tests. 4. Choosing the right test. Guide viewers on selecting a reliable pregnancy test kit. 5. Reading the instructions. Emphasize the importance of thoroughly reading the instructions before starting the test. 6. Gathering supplies. List the necessary items needed for taking the test. 7. Collecting urine sample. Offer tips on how to collect a urine sample properly for the test. 8. Performing the test. Step-by-step demonstration on how to perform the test accurately. 9. Waiting period. Explain the waiting period before checking the results and why it's essential. 10. Interpreting results. Provide guidance on interpreting the results correctly, including what different symbols or lines mean. 11. False positives and negatives. Address factors that could lead to false positive or negative results. 12. Next steps. Discuss what to do after getting the results, whether positive or negative. 13. Seeking medical advice. Highlight the importance of consulting a healthcare professional for confirmation and further guidance. 14. Emotional support. Offer reassurance and support for viewers, acknowledging the emotional impact of pregnancy test results. 15. FAQs. Answer common questions about pregnancy tests, addressing concerns and misconceptions. 16. Tips for accuracy. Provide additional tips to ensure accurate results, such as testing in the morning and avoiding certain medications. 17. Handling results. Discuss how to cope with different outcomes and offer resources for support. 18. Partner involvement. Encourage involving partners in the testing process and decision-making. 19. Test disposal. Guide viewers on proper disposal of used pregnancy tests. 20. Conclusion. Summarize key points, reiterate the importance of accuracy, and offer encouragement to viewers.
Welcome to Healthcare Lover. Today, we're going to discuss the top 10 foods to eat and avoid during pregnancy to ensure a healthy journey for both you and your baby. Point 1. Folate-rich foods. First on our list is folate-rich foods. These include leafy greens, lentils, and citrus fruits. Folate is essential for neural tube development in the baby. Point 2. Lean protein. Lean protein sources like chicken, fish, and tofu are crucial for baby's growth and maternal health. Avoid undercooked or raw seafood. Point 3. calcium-rich dairy. Next up, calcium-rich dairy products such as milk, yogurt, and cheese support the baby's bone development. Opt for pasteurized options. Point 4. Iron-packed foods. Iron is vital during pregnancy. Include foods like lean red meat, beans, and fortified cereals to prevent anemia. Point 5. Fiber-packed fruits and vegetables. Fiber is your friend during pregnancy. Fruits, veggies, and whole grains help with digestion and reduce constipation. Point 6. Healthy fats. Healthy fats from avocados, nuts, and olive oil are essential for baby's brain development. They also help with your skin and hair. Point 7. Hydration. Staying hydrated is crucial. Drink plenty of water and consider herbal teas, but limit caffeine intake. Point 8. Foods to avoid. Raw seafood and unpasteurized products. Now, let us discuss foods to avoid. First, steer clear of raw seafood and unpasteurized dairy products to prevent foodborne illnesses. Point 9. High mercury fish. High mercury fish like shark and swordfish should be avoided as they can harm the baby's nervous system. Point 10. Processed and high sugar foods. Lastly, minimize processed and high sugar foods. They can lead to excessive weight gain and gestational diabetes. Conclusion: to sum it up, a balanced diet during pregnancy is crucial for a healthy mom and baby. Remember to consult your healthcare provider for personalized advice. Call TO Action. If you found this information helpful, don't forget to like, share, and subscribe to our channel for more pregnancy tips and advice. OUTRO, thanks for watching, and we wish you a safe and healthy pregnancy journey.
Title: Understanding Anemia in Pregnancy, Symptoms and Deficiency. 1. Introduction. Greetings everyone. Welcome back to our channel. Today we'll be discussing a crucial topic for expecting mothers: anemia during pregnancy. 2. Definition of anemia. Let's start by understanding what anemia is. Anemia is a condition characterized by a lack of healthy red blood cells, leading to reduced oxygen flow to the body's tissues. 3. Prevalence in pregnancy. During pregnancy, the prevalence of anemia increases due to the body's increased blood volume and the demands of the growing baby. 4. Importance of iron. One common cause of anemia in pregnancy is iron deficiency. Iron is vital for the production of hemoglobin, the protein in red blood cells that carries oxygen. 5. Symptoms of anemia. Now, let's delve into the symptoms. Fatigue and weakness are hallmark signs of anemia, often exacerbated during pregnancy due to the added strain on the body. 6. Pale skin and nails. Anemic individuals may experience paleness of the skin and nails, as reduced hemoglobin levels affect the skin's color. 7. Shortness of breath. Shortness of breath, even with minimal exertion, can be a notable symptom as the body struggles to transport enough oxygen. 8. Dizziness and lightheadedness. Anemia can lead to dizziness and lightheadedness, making it essential for pregnant individuals to be aware of these signs. 9. Rapid heartbeat. A rapid or irregular heartbeat is another indicator of anemia, reflecting the heart's attempt to compensate for reduced oxygen carrying capacity. 10. Cold hands and feet. Poor circulation due to anemia may result in cold extremities, such as hands and feet. 11. Cognitive impairment. Cognitive impairment, including difficulty concentrating and memory issues, can arise due to insufficient oxygen reaching the brain. 12. Cravings for non-food items. A unique symptom called pica may occur, leading to cravings for non-food items, like ice or dirt, often associated with iron deficiency. 13. Risk factors. Certain factors increase the risk of anemia in pregnancy, such as inadequate iron intake, multiple pregnancies, and a history of anemia. 14. Importance of prenatal vitamins. Prenatal vitamins containing iron are commonly recommended to prevent and treat anemia in pregnancy. Always consult with your healthcare provider. 15. Dietary recommendations. Incorporating iron-rich foods like leafy greens, lean meats, and legumes into your diet is crucial for maintaining healthy iron levels. 16. Routine blood tests. Regular blood tests during prenatal care help monitor hemoglobin levels, enabling early detection and intervention. 17. Treatment options. Treatment may involve iron supplements prescribed by your healthcare provider, alongside dietary adjustments. 18. Follow-up and monitoring. Regular follow-up appointments and monitoring ensure that the chosen treatment is effectively addressing the anemia. 19. Conclusion. In conclusion, understanding anemia's symptoms and causes during pregnancy is vital for ensuring a healthy journey for both the mother and the baby. 20. Call to action. If you found this video helpful, don't forget to like, share, and subscribe. And as always, consult your healthcare provider for personalized advice. Thanks for tuning in.
Hey there, lovely viewers. We're thrilled to have you back on our channel. Today, we're diving deep into a topic that's close to many hearts: how to boost your chances of getting pregnant. Whether you're just starting your journey or have been trying for a while, these detailed tips could be the key you're looking for. Point 1. Understand your menstrual cycle. Your menstrual cycle consists of different phases: follicular, ovulation, and luteal. Ovulation usually occurs around the middle of your cycle. Keep track of it using methods like basal body temperature or ovulation predictor kits. The fertile window spans a few days before and after ovulation, so aim for intimacy during this time. Point 2. Maintain a healthy lifestyle. Nutrition plays a pivotal role in fertility. Incorporate a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats into your diet. Regular, moderate exercise can help regulate your hormones and boost overall well-being. Stress can interfere with ovulation. Practice stress reduction techniques like meditation, mindfulness, or even enjoyable hobbies. Point 3. Maintain a healthy weight. Being underweight can disrupt hormonal balance, while excess weight can lead to insulin resistance and irregular cycles. Aim for a BMI within the healthy range for optimal fertility. Point 4. Avoid harmful substances. Smoking can decrease fertility in both men and women. Quitting is a major step towards improving your chances. Limit alcohol consumption, as excessive intake may affect hormone levels. High caffeine intake has been linked to reduced fertility, so consider cutting back. Point 5. Preconception health check. Before embarking on your pregnancy journey, schedule a thorough health checkup with your doctor. Discuss any pre-existing conditions, medications, or supplements you're taking that could impact fertility. Point 6. Stay hydrated. Drinking enough water helps maintain healthy cervical mucus, which plays a role in fertility. Point 7. Timing matters. It's important to remember that pregnancy might not happen right away. Continue trying during your fertile window, but don't stress if it takes some time. Point 8. Communication is key. Openly communicate with your partner about your feelings, concerns, and expectations. Keep the lines of dialogue open throughout the journey. Point 9. Seek professional help if needed. If you're having trouble conceiving, don't hesitate to consult a fertility specialist. They can perform tests to identify any underlying issues and recommend appropriate treatments. Conclusion. Thank you so much for joining us today as we explored these comprehensive tips for increasing your chances of getting pregnant. Remember, each person's fertility journey is unique, so be patient and kind to yourselves. If you found this video helpful, don't forget to give it a thumbs up, share it with others, and hit that subscribe button for more insightful content.
Pregnancy, childbirth, and all the associated experiences are, in my personal opinion, the most extraordinary processes in human biology. However, it's essential to recognize that it's not all sunshine and rainbows. Despite the beauty of children, the journey of bringing them into the world can entail some uncomfortable consequences. In today's video, we'll delve into the changes that occur in a mother's body during pregnancy, exploring phenomena such as morning sickness, fatigue, changes in taste, and the impacts on internal organs as the uterus expands to accommodate the growing fetus. Let's dive into this fascinating topic. Intro. While I may not have experienced pregnancy firsthand, I've had the privilege of witnessing this incredible process twice in my life. The sheer marvel of it is beyond words. My aim with this video is not to dwell on the negatives, but to shed light on some commonly experienced symptoms of pregnancy. In future videos, we'll explore the many beautiful aspects of pregnancy. First on the list is morning sickness. Contrary to its name, it can occur at any time of day and isn't obliged to vanish post-lunch. Although the precise cause remains elusive, the hormone HCG likely plays a significant role. HCG, or human chorionic gonadotropin, doubles every 48 to 72 hours during the first 12 weeks of pregnancy, peaking and then declining. Higher levels may indicate multiple pregnancies or issues like Down syndrome. While most experience relief by weeks 12 to 16, some endure severe morning sickness throughout, known as hyperemesis gravidarum, which poses serious challenges. Moving on to fatigue, progesterone, and its metabolite, allopregnanolone, are key players. Progesterone levels rise steadily throughout pregnancy, contributing to drowsiness due to enhanced responsiveness to the neurotransmitter GABA. Fatigue tends to ebb in the second trimester before resurfacing in the third, influenced by various hormonal changes and the physical and emotional toll of pregnancy. Another common phenomenon is changes in taste, often characterized by a metallic or bitter flavor. While the mechanism isn't fully understood, estrogen likely plays a significant role. Pregnant individuals, particularly females with elevated estradiol levels, report alterations in taste perception, affecting food preferences and aversions. Lastly, the third trimester brings physical discomfort as the expanding uterus displaces surrounding organs. The greater omentum, intestines, stomach, liver, gallbladder, and even the heart and lungs undergo significant shifts to accommodate the growing fetus. While these changes are awe-inspiring, they undoubtedly contribute to discomfort. There are numerous other transformations in a mother's body during pregnancy, including alterations in liver metabolism, kidney function, and digestive system, peristalsis. Feel free to suggest topics for future videos in the comments below. Thanks for tuning in, and I'll catch you in the next video.
Welcome back to our channel, where we provide valuable information and support for those on their journey from infertility to fertility. Today, we'll be discussing the step-by-step process of transitioning from infertility to achieving a successful pregnancy. If you're new here, don't forget to hit the subscribe button and the notification bell so you won't miss any of our informative videos. Let us dive right into it. Step 1. Seeking professional help. The first crucial step in the journey is seeking professional help. Consult a reproductive endocrinologist or fertility specialist to evaluate your medical history, conduct tests, and diagnose any underlying issues causing infertility. Step 2. Diagnosis and treatment plan. Once diagnosed, your fertility specialist will create a personalized treatment plan. This may include lifestyle changes, medications, or advanced assisted reproductive technologies like in vitro fertilization (IVF), intrauterine insemination (IUI), or egg freezing. Step 3. Lifestyle and dietary changes. Making positive lifestyle changes can significantly impact your fertility. Maintain a healthy weight, exercise regularly, and consume a balanced diet rich in vitamins, minerals, and antioxidants. Reducing stress through activities like yoga or meditation can also be beneficial. Step 4. Medications and hormonal therapy. In some cases, hormonal imbalances may be causing infertility. Your specialist might prescribe medications to regulate your hormones and improve your chances of conception. Step 5. Assisted reproductive technologies (ART). When other methods aren't successful, you may explore assisted reproductive technologies such as IVF. This involves fertilizing eggs with sperm in a laboratory and transferring the resulting embryos into the uterus. Step 6. Egg or sperm donation. If needed, you may consider using donated eggs or sperm. This option is often chosen when a partner has low-quality eggs or sperm or in cases of same-sex couples. Step 7. Surrogacy. Surrogacy is another option for individuals or couples who can't carry a pregnancy themselves. A surrogate mother carries the pregnancy on behalf of the intended parents. Step 8. Adoption. If achieving a biological pregnancy isn't possible, adoption is a wonderful way to build a family. Adoption agencies can help match you with a child, and the process varies by country and jurisdiction. Step 9. Emotional support. Throughout this journey, emotional support is essential. Consider joining support groups, seeking therapy, or confiding in close friends and family members who can provide comfort and understanding. Step 10. Patience and persistence. Remember, the path from infertility to fertility can be challenging, but staying patient and persistent is key. Celebrate small victories, lean on your support network, and never lose hope. Conclusion. Host. That wraps up our step-by-step guide on transitioning from infertility to fertility. We hope you found this information helpful and encouraging. If you have any questions or would like us to cover specific topics in the future, please leave a comment below. Don't forget to give this video a thumbs up and share it with anyone who might benefit. Thank you for watching, and we'll see you in the next video. Stay strong and keep believing in the power.
Unlocking the secret to boost female fertility. Top 20 foods for improved egg quality. Introduction. Hello everyone. Welcome back to our channel. Today we have an incredibly important topic to discuss, something that many women may find valuable on their fertility journey. We'll be diving into the top 20 foods that can significantly enhance female egg quality. If you're ready to unlock the secret to boosting your fertility, stay tuned. Segment 1. Importance of female egg quality. Before we get into the list, let's understand why female egg quality is crucial for conception. The quality of your eggs plays a pivotal role in fertility, affecting not just the likelihood of conception, but also the health of the baby. Now, let's jump into the first set of foods that can make a positive impact. Segment 2. Dark leafy greens. Our number 1 on the list is dark leafy greens such as spinach and kale. Packed with essential nutrients like folate and iron, these greens promote optimal egg development and overall reproductive health. Add a generous serving of these greens to your diet for a fertility boost. Segment 3. Berries. Next up, we have berries. Blueberries, strawberries, and raspberries. Loaded with antioxidants, these little powerhouses protect your eggs from oxidative stress, enhancing their quality. Snack on a handful of berries daily to give your fertility a sweet and nutritious kick. Segment 4. Avocado. Moving on to number 3. Avocados. Rich in monounsaturated fats and vitamin E, avocados support hormonal balance and nourish your reproductive system. Incorporating avocados into your diet can positively impact your egg quality over time. Segment 5. Fatty fish. Let's talk about fatty fish like salmon and mackerel, omega-3. Fatty acids found in these fishes are essential for reproductive health. They not only improve egg quality, but also contribute to a healthy pregnancy. Aim for at least 2 servings of fatty fish per week. Segment 6. Nuts and seeds. Nuts and seeds come in at number 5. Almonds, walnuts, and flax seeds are rich in omega-3s and antioxidants, promoting better egg quality. Snacking on a handful of these daily can be a simple yet effective way to boost your fertility. Segment 7. Quinoa. Quinoa takes the 6th spot on our list. This whole grain is a fantastic source of protein and essential amino acids, supporting overall reproductive health. Swap out refined grains for quinoa to give your body the nutrients it needs for optimal eggs quality. Segment 8. Greek yogurt. Number 7 is Greek yogurt. Packed with protein and probiotics, Greek yogurt promotes a healthy gut, positively influencing your reproductive system. Choose the unsweetened variety for maximum benefits. Segment 9. Broccoli. Broccoli, our 8th contender, is rich in folate and other crucial nutrients. It aids in regulating hormones and supporting healthy egg development. Steam or stir-fry broccoli as a tasty and nutritious side dish to boost your fertility. Segment 10. Lean protein. Lean protein sources like chicken and turkey make it to number 9. Protein is essential for overall health, and incorporating lean sources into your diet helps provide the necessary building blocks for optimal egg quality. Segment 11. Eggs. It might sound cliche, but eggs are our number 10. They are a fantastic source of high-quality protein, choline, and antioxidants. Including eggs in your diet can contribute to improved egg quality over time. Segment 12. Citrus fruits. Let's move on to number 11. Citrus fruits like oranges and grapefruits. Packed with vitamin C, these fruits support the production of collagen, a crucial component for healthy eggs. Add a citrusy twist to your diet for a fertility boost. Segment 13. Pumpkin seeds. Pumpkin seeds claim the 12th spot on our list. These tiny seeds are rich in zinc, a mineral essential for reproductive health. Snacking on pumpkin seeds can contribute to better egg quality and hormonal balance. Segment 14. Beans and lentils. Beans and lentils come in at number 13. These plant-based protein sources are high in fiber and essential nutrients, supporting hormonal balance and reproductive health. Incorporate a variety of beans and lentils into your meals. Segment 15. Sweet potatoes. Number 14 is sweet potatoes. Packed with beta-carotene and vitamin A, sweet potatoes support healthy egg development. Swap regular potatoes for the sweet variety to enhance your fertility. Segment 16. Tomatoes. Tomatoes take the 15th spot. Rich in lycopene, an antioxidant, tomatoes support reproductive health by protecting eggs from damage. Add fresh tomatoes to your salads or enjoy them in cooked dishes. Segment 17. Asparagus. Asparagus claims the 16th spot. This green veggie is loaded with folate, promoting optimal egg quality and hormonal balance. Steam or roast asparagus for a delicious and fertility-boosting side dish. Segment 18. Beets. Beets at number 17 are rich in nitrates and antioxidants. They support blood flow to the reproductive organs, positively influencing egg quality. Incorporate beets into your diet for a natural fertility boost. Segment 19. Lean red meat. Lean red meat makes it to number 18. Rich in iron and zinc, red meat supports overall reproductive health. Choose lean cuts and enjoy them in moderation to enhance your fertility. Segment 20. Water. Last but not least, staying hydrated is crucial for optimal fertility. Drinking enough water ensures proper circulation, supporting the delivery of nutrients to the reproductive organs. So, don't forget to keep yourself well hydrated throughout the day. Conclusion. And there you have it, the top 20 foods to improve female egg quality. Remember, making these dietary changes is a journey, and consistency is key. If you found this video helpful, give it a thumbs up, and don't forget to subscribe for more valuable content. Wishing you all the best on your fertility journey. Until next time, take care. Outro. Thank you for watching, and we'll see you in the next video. Stay healthy and happy.
Intro. Hey there, amazing viewers. Welcome back to our channel. Today, we have a topic that's close to the heart, pregnancy and self-care tips. Whether you're expecting, planning to be, or just curious, you're in for a treat. Stick around for the top 15 points that'll make your pregnancy journey a breeze. Point 1. Mindful nutrition. First up, let's talk about nourishing yourself and your little one. Opt for nutrient-rich foods, plenty of fruits and veggies, and don't forget that hydration game. Point 2. Gentle exercises. Next on the list is staying active, but no need for intense workouts. Gentle exercises like prenatal yoga or a simple stroll can do wonders for your well-being. Point 3. Beauty of rest. Ah, the beauty of rest. Embrace those power naps and full night's sleep. Your body and mind will thank you. Trust me. Point 4. Emotional wellness. It's okay to have mixed emotions. Prioritize your emotional well-being, whether through journaling, meditation, or just having heart-to-heart talks. Point 5. Pamper yourself, pamper time, treat yourself to a relaxing bath, a prenatal massage, or whatever makes you feel like the queen you are. Point 6. Support system. Surround yourself with positivity. Your support system is crucial. Friends, family, or fellow mom-to-be pals. Point 7. Educate yourself. Knowledge is power. Educate yourself about the beautiful journey you're on. Attend prenatal classes, read books, and absorb all the information. Point 8. Regular checkups. Speaking of information, regular checkups are a must. Keep track of your and your baby's health with those scheduled visits to your healthcare provider. Point 9. Fashionable comfort. Who says you can't be fashionable and comfortable? Invest in maternity, wear that makes you feel good and accommodates that growing belly. Point 10. Hygiene essentials. Pay extra attention to hygiene. A healthy baby. It's the little things that count. Point 11. Positive affirmations. Daily affirmations are like a power boost for your mindset. Remind yourself of the amazing journey you're on and the incredible mom you're becoming. Point 12. Create memories. Capture those beautiful moments. Whether it's through a pregnancy photo shoot or a simple diary, create memories that'll last a lifetime. Point 13. Delegate tasks. Don't be shy to ask for help. Delegate tasks and focus on what truly matters, your well-being and your babies. Point 14. Stay flexible. Plans might change, and that's okay. Stay flexible and adapt to the beautiful uncertainties of this journey. Point 15. Celebrate milestones. Last but not least, celebrate the milestones. Every kick, every ultrasound, it's all part of your incredible story. Outro. And there you have it, the top 15 points for a happy and healthy pregnancy. If you enjoyed this video, don't forget to give it a thumbs up, subscribe, and hit that notification bell. Until next time, take care of yourself and that precious bump. Sending lots of love.
C-Section Recovery Guide, 20 Essential Tips for New Moms. 1. Introduction. Start by welcoming viewers and acknowledging the commonality of C-sections in childbirth. 2. Immediate post-op care. Discuss the importance of following medical advice for wound care and pain management. Highlight the significance of rest and limited physical activity in the initial days. 3. Incision care. Explain how to clean and care for the incision site. Stress the significance of keeping the incision dry and watching for signs of infection. 4. Pain management. Talk about prescribed pain medications and their proper usage. Suggest non-pharmacological methods like using a heating pad or practicing deep breathing exercises. 5. Activity guidelines. Emphasize the need for gradual reintroduction of daily activities. Recommend avoiding heavy lifting and strenuous exercise until approved by a healthcare professional. 6. Nutrition and hydration. Highlight the importance of maintaining a healthy diet for recovery. Encourage staying hydrated to aid in healing. 7. Monitoring postpartum bleeding. Discuss what is considered normal postpartum bleeding and when to seek medical attention. 8. Emotional well-being. Address the emotional aspects of recovery and potential postpartum emotions. Encourage open communication with healthcare providers about mental health concerns. 9. Follow-up appointments. Stress the importance of attending post-operative checkups. Explain what to expect during these appointments and how healthcare providers monitor recovery. 10. Support system. Discuss the role of family and friends in providing support. Emphasize the importance of seeking help when needed. 11. Breastfeeding after C-section. Offer guidance on breastfeeding positions that are comfortable post-surgery. Highlight the benefits of breastfeeding for both the mother and baby. 12. Scar massage. Introduce scar massage as a technique to promote healing and reduce scar tissue. Demonstrate gentle massage techniques. 13. Resuming intimacy. Discuss the importance of waiting until physically and emotionally ready. Provide tips for comfortable intimacy post-C-section. 14. Postpartum exercise guidelines. Explain when it's safe to start postpartum exercises. Offer examples of gentle exercises to aid in recovery. 15. Birth control options. Discuss contraceptive options suitable for post-C-section recovery. Encourage discussions with healthcare providers about family planning. 16. Warning signs. Outline potential complications and the importance of recognizing warning signs. Stress the need to seek immediate medical attention for any concerning symptoms. 17. Scar appearance. Address common concerns about the appearance of the scar. Provide reassurance that scars tend to fade over time. 18. Returning to work. Discuss factors to consider when planning a return to work. Emphasize the importance of balancing work responsibilities with ongoing recovery needs. 19. Long-term care considerations. Mention the potential for future pregnancies and how that may impact the C-section scar. Discuss any long-term considerations or precautions advised by healthcare professionals. 20. Conclusion. Summarize key points. Encourage viewers to consult with their healthcare providers for personalized advice. Remember to tailor the script to your audience and provide a disclaimer to consult with healthcare professionals for personalized advice.
Introduction. Emphasize the transformative journey of pregnancy. Discuss the emotional and physical changes women experience. Calculating weeks. Clarify that the LMP method is a standard for tracking pregnancy. Note that not all months have the same number of days, so weeks may not align perfectly. Month-to-week conversion. Break down weeks further, explaining the significance of each week. Highlight milestones like the baby's heartbeat starting around week 6. Trimesters. Detail major developments in each trimester, such as organ formation and fetal movement. Discuss common symptoms and changes experienced by the mother. Due date calculation. Explain the Naegele's rule for estimating the due date. Stress the importance of ultrasounds for accurate dating and monitoring fetal growth. Common pregnancy terms. Elaborate on terms like term, preterm, and postterm. Discuss the potential challenges and care associated with preterm births. Tips for tracking. Recommend apps that provide daily insights and tips. Suggest creating a pregnancy journal to document experiences and questions for healthcare providers. Closing. Reinforce the uniqueness of each pregnancy journey. Express support for viewers going through this experience. Disclaimer. Emphasize that the provided information is general and may not cover specific cases. Encourage seeking professional advice for personalized guidance. Call to action. Ask viewers to share their pregnancy stories or questions. Remind them to consult healthcare providers for accurate and personalized information.
Menopause and Hormonal Changes Guide Tips Intro. Hey there, wonderful people. Welcome back to Healthcare Lover. Today we're diving deep into a topic that affects so many incredible women out there. Menopause and hormonal changes. Yes, we're unraveling the mysteries behind those 15 crucial points. So, grab a cup of tea, get cozy, and let's get started. Point number one, understanding the basics. Menopause is a natural biological process that every woman goes through, typically in her late 40s or early 50s. It marks the end of the menstrual cycle and fertility. But what exactly happens during this time? Let's find out. Point 2. Hormonal roller coaster. As women approach menopause, there's a significant drop in estrogen and progesterone levels. These hormonal fluctuations can lead to a variety of symptoms, from hot flashes to mood swings. Ladies, you are not alone in this. Point 3. Impact on mood and emotions. Hormones play a crucial role in regulating our emotions. During menopause, the hormonal imbalance can contribute to mood swings, irritability, and even anxiety. It's essential to acknowledge and address these changes. Point 4. The infamous hot flashes. The notorious hot flashes. We've all heard about them, but what causes these sudden bursts of heat? Stay tuned as we explore this in point number 4. Point 5. Sleep disturbances. Menopause often brings along sleep challenges. From insomnia to night sweats, getting a good night's sleep can become quite the struggle. But fear not, we'll discuss strategies to help you catch those ZES. Point 6. Weight gain and metabolism. Hormonal changes can affect metabolism, making it easier to gain weight, especially around the abdominal area. But fret not, we've got tips to help you maintain a healthy lifestyle during this phase. Point 7. Bone health. Estrogen plays a crucial role in maintaining bone density. With its decline during menopause, the risk of osteoporosis increases. Let's delve into how to support your bones through nutrition and lifestyle choices. Point 8. Memory and cognitive changes. Some women experience changes in memory and cognitive function during menopause. We'll explore these changes and share strategies to keep your mind sharp. Point 9. Skin and hair transformations. Hormonal changes can impact the skin's elasticity and lead to hair thinning. But worry not, we've got beauty tips to help you embrace and enhance your natural radiance. Point 10. Sexual health during menopause. Let's address the elephant in the room. Changes in hormones can affect libido and vaginal health. We'll discuss open communication with your partner and ways to maintain intimacy. Point 11. Managing stress. Menopause can be a stressful time, but stress exacerbates symptoms. Learn effective stress management techniques to navigate this phase with grace. Point 12. Hormone replacement therapy, HRT. For some women, HRT can be a game changer in managing menopausal symptoms. We'll explore the pros and cons to help you make an informed decision. Point 13. Nutrition and supplements. A balanced diet and specific supplements can alleviate menopausal symptoms. Let's explore the foods and nutrients that can make a positive impact on your well-being. Point 14. Exercise and its role. Regular physical activity can make a significant difference in how you experience menopause. Discover the types of exercises that can boost your mood and overall health. Point 15. Embracing the journey. Menopause is a transformative period, and embracing the changes is key. We'll leave you with empowering tips to celebrate this new chapter of life. Outro. And there you have it, folks. 15 points to demystify menopause and hormonal changes. If you found this video helpful, don't forget to give it a thumbs up, subscribe to Healthcare Lover for more insightful content, and hit that notification bell so you know.
Title: Understanding Pregnancy Complications, Signs and Symptoms. 1. Introduction. Welcome viewers to our channel. Today, we'll discuss crucial information about recognizing pregnancy complications. 2. Common pregnancy complications. Highlight common complications like preeclampsia, gestational diabetes, and placenta previa. Briefly explain each complication and its potential impact on both the mother and the baby. 3. Signs and symptoms. Discuss general signs such as persistent pain, swelling, or sudden weight gain. Break down specific symptoms associated with different complications. 4. Preeclampsia. Elaborate on high blood pressure and protein in urine as key indicators. Emphasize the importance of regular prenatal checkups for early detection. 5. Gestational diabetes. Explain how elevated blood sugar levels during pregnancy can pose risks. Encourage awareness of symptoms like increased thirst and frequent urination. 6. Placenta previa. Describe the condition where the placenta covers the cervix. Emphasize the need for immediate medical attention if there's vaginal bleeding. 7. Preterm labor. Discuss warning signs like regular contractions before 37 weeks. Encourage seeking medical help if contractions persist. 8. Ectopic pregnancy. Explain the risks associated with a fertilized egg implanting outside the uterus. Stress the importance of recognizing symptoms like severe abdominal pain and shoulder pain. 9. Infections. Briefly touch on common infections during pregnancy. Advocate for good hygiene and regular prenatal care to prevent infections. 10. Hemorrhage. Explain the risks of excessive bleeding during pregnancy. Emphasize the urgency of seeking medical help for any unexplained bleeding. 11. Multiple pregnancies. Discuss potential complications in twin or multiple pregnancies. Highlight the importance of specialized care and monitoring. 12. Importance of regular checkups. Stress the significance of prenatal appointments in detecting and addressing complications early. Encourage open communication with healthcare providers. 13. Self-monitoring. Advise pregnant individuals to be attentive to their bodies. Encourage reporting any unusual symptoms promptly to healthcare professionals. 14. Support system. Emphasize the role of emotional support during pregnancy. Highlight the importance of involving partners, family, and friends. 15. Emergency plan. Discuss the importance of having an emergency plan in case complications arise. Encourage pregnant individuals to know emergency contact numbers and the nearest medical facilities. 16. Nutrition and lifestyle. Briefly touch on the significance of a healthy diet and lifestyle. Recommend regular exercise under professional guidance. 17. Medical interventions. Discuss potential medical interventions for managing complications. Stress that early intervention can improve outcomes. 18. Case studies, testimonials. Share real-life experiences of individuals who recognized and addressed complications. Offer hope and inspiration to viewers facing similar situations. 19. Conclusion. Summarize key points discussed. Reiterate the importance of awareness, regular checkups, and prompt medical attention. 20. Closing. Thank viewers for watching. Encourage them to subscribe for more informative content. Remind them that early detection and proper management of complications can lead to healthier pregnancies.
IUI stands for intrauterine insemination, which is a fertility treatment used to increase the chances of pregnancy. The procedure involves placing sperm directly into a woman's uterus to facilitate fertilization. IUI is commonly used to treat infertility due to low sperm count, decreased sperm motility, or issues with cervical mucus. Prior to the procedure, the woman may receive ovulation-inducing medication to increase the likelihood of successful fertilization. IUI is a relatively simple and non-invasive procedure that can be performed in a doctor's office. It is usually painless and does not require anesthesia. The success rate of IUI varies depending on several factors, including age, fertility issues, and the number of insemination cycles performed. The risks of IUI are minimal, but there is a small risk of infection or discomfort. IUI is often combined with other fertility treatments, such as in vitro fertilization, IVF, to improve the chances of pregnancy. Overall, IUI can be an effective treatment option for couples struggling with infertility, but it is important to discuss all available options with a fertility specialist to determine the best course of action.
Title: Relieve Back Pain During Pregnancy, 20 Practical Tips for Moms-to-Be. 1. Introduction. Greet your viewers and mention the common issue of back pain during pregnancy. Highlight the importance of addressing and relieving back pain for a more comfortable pregnancy. 2. Consult your healthcare provider. Emphasize the importance of consulting with a healthcare professional before trying any remedies. 3. Maintain good posture. Explain how maintaining proper posture can alleviate strain on the back. 4. Gentle prenatal exercises. Suggest safe and gentle exercises to strengthen the core and back muscles. 5. Pelvic tilt exercises. Demonstrate pelvic tilt exercises for strengthening and flexibility. 6. Prenatal yoga. Discuss the benefits of prenatal yoga in relieving back pain. 7. Warm up before exercise. Emphasize the importance of warming up before engaging in any physical activity. 8. Supportive footwear. Recommend comfortable and supportive footwear to reduce stress on the spine. 9. Use pregnancy pillows. Explain how using pregnancy pillows can provide extra support during sleep. 10. Regular breaks. Encourage taking short breaks to avoid prolonged sitting or standing. 11. Hot-cold therapy. Discuss the use of hot or cold packs for temporary relief. 12. Massage and acupressory. Highlight the benefits of massage or acupressure for relaxation and pain relief. 13. Hydrate and maintain a healthy diet. Emphasize the importance of staying hydrated and consuming a balanced diet for overall health. 14. Avoid high heels. Advise against wearing high heels as they can contribute to back discomfort. 15. Incorporate lumbar support. Suggest using a lumbar support pillow or cushion when sitting for extended periods. 16. Stay active. Encourage regular, low-impact activities to keep the body moving. 17. Swimming. Mention the benefits of swimming for buoyancy and reduce strain on the back. 18. Breathing exercises. Introduce deep breathing exercises to promote relaxation and reduce tension. 19. Consider prenatal massage therapy. Discuss the potential benefits of professional prenatal massage for back pain relief. 20. Conclusion. Summarize key points and remind viewers to consult with their healthcare provider before trying any new methods. Remember to speak clearly, use engaging visuals, and make it easy for viewers to follow along with the practical tips you're providing.
Welcome back to Healthcare Lover. Today, we're diving into a topic that's close to my heart, eating healthy on a budget. Yep, you heard it right. Eating nutritious meals doesn't have to break the bank. Stick around as we unveil the top 20 points for healthy eating on a budget. Point 1. Plan your meals. Host. First things first, folks. Planning is key. Take a little time each week to plan your meals. It not only helps you stay organized, but also prevents unnecessary trips to the store and those impulse junk food buys. Point 2. Buy in bulk. Now, let's talk about buying in bulk. Purchasing staples like rice, beans, and oats. In bulk not only saves money, but ensures you always have a solid foundation for your meals. Point 3. Seasonal produce. Ah, the beauty of seasonal produce. Opt for fruits and veggies that are in season. They're not only fresher, but also more affordable. Pro tip. Farmers markets are fantastic for scoring some great deals. Point 4. Frozen is your friend, don't shy away from the frozen aisle. Frozen fruits and vegetables are often just as nutritious as fresh ones and have a longer shelf life. Plus, they can be more budget-friendly. Point 5. Meal prep magic. Meal prep is a game changer. Spend a few hours each week preparing your meals in advance. Not only does it save you time, but it also keeps you from opting for those less healthy, on-the-go choices. Point 6. DIY snacks. Snacking doesn't have to be a guilty pleasure. Make your own snacks at home, like trail mix or granola bars. It's not only healthier, but also more cost-effective. Point 7. Store brands rock. Let's talk about loyalty. Store loyalty. Don't overlook store brands. They're often just as good as the fancy labels, but come with a friendlier price tag. Point 8. Coupon craze. Coupons, coupons, coupons. Embrace the coupon craze. Keep an eye out for discounts, both online and in-store. They can add up to significant savings over time. Point 9. Buy frozen proteins. Protein can be pricey, but fear not. Frozen proteins like chicken breasts or fish fillets are often more affordable than their fresh counterparts. Stock up when you spot a good deal. Point 10. Nourish on a dime. Nourishing your body doesn't have to cost a fortune. Opt for budget-friendly superfoods like lentils, quinoa, and sweet potatoes. They pack a nutritional punch without emptying your wallet. Outro, and that's a wrap for today's video on healthy eating without breaking the bank. If you found these tips helpful, don't forget to give us a thumbs up, hit that subscribe button, and ring that notification bell so you never miss out on our budget-friendly recipes and wellness tips. Until next time, stay healthy and budget savvy.
Start with a warm welcome and a brief introduction to the topic. Mention the importance of understanding ovulation for those trying to conceive or practicing contraception. Point 1. Know your menstrual cycle. Explain that ovulation occurs in the middle of your menstrual cycle. Discuss the typical menstrual cycle length, which is around 28 days, but can vary. Emphasize that tracking your cycle is essential. Point 2. Start with day 1. Explain that the first day of your menstrual bleeding is considered day 1 of your cycle. Point 3. Calculate your cycle length. Instruct viewers to record the number of days between the start of one period to the start of the next for a few months. Highlight that cycle length can vary and may not always be the same. Point 4. Determine your ovulation window. Mention that the ovulation window is usually around the midpoint of the cycle. To find it, subtract 14 from your average cycle length. For example, if your cycle is 28 days, subtract 14 to get 14. Your ovulation window is around day 14. Point 5. Use ovulation prediction kits. OPKs. Explain that OPKs can help pinpoint ovulation more accurately. Describe how to use OPKs by following the package instructions.